Another young Indian dies of heart attack. This time, this is a 42-year-old female named Shefali Jariwala, who by the news appears to be a TV star. Now, this is unbelievable. This is very shocking. When I did my MBBS and when I did my PG training and also working in a cardiac ICU with patients who had heart attacks and had bypass surgeries, the classic teaching was women of this age do not have heart attack because they have high estrogen, which protects their heart from having heart attacks. I'm starting to think, did something change? Then I went back and looked. The American Heart Association says the same thing, that it's protective. Big hospitals like the Cleveland Clinic, Mayo Clinic, on their website say that
estrogen is providing an incredible protective effect against heart disease for women, which is really why the risks only go up for women in most cases after menopause and later in life.
Sure, this is atypical. But the more curious question is, what exactly happened? When I looked at the news, they say cardiac arrest is the cause of death. That makes no sense because cardiac arrest essentially means the heart is not having any electrical activity. In other words, the heart is not beating. We all have a beating heart, which is why we're all alive. But if the heart stops beating, it's called a cardiac arrest. In pretty much everyone, cardiac arrest would be the cause of death because the heart eventually stops. But the most important question is, what causes cardiac arrest? So it looks like she had a heart attack. Again, very unusual. A heart attack is a condition where the supply of oxygen to the heart is reduced, or the activity of the heart is so much that the oxygen that's going to the heart is not enough. But either ways, heart attack, cardiac arrest. But the most important question we need to know is, what was the risk factor that caused a heart attack in such a young, healthy woman? This is very scary and unfortunate. If healthy people who supposedly are having these problems, apart from unfortunately the Indian genetics, I actually have no idea. But let's wait and see what more report we have, and hopefully the people can come up with what exactly was the risk factors in this situation, so other people can learn something from this event, which is very unfortunate, and subsequently take precautionary steps. Cardiac arrest because of heart attack. And what is heart attack because of? There are so many risk factors, and it would be interesting to know what actually was the risk factor that led to this unfortunate, untimely event. I also pray that the friends and family of Shefali have strength in order to deal with this huge, unexpected loss. All right, I'll be talking as I learn more about this. Stay healthy, stay fit. I'll talk to you soon.